how to optimize topical care and just some anecdotal experiences. Well, topical treatment can be extraordinarily effective. And I completely agree with Steve that adherence is absolutely crucial. It's something that is very hard for patients to build into the lifestyle. We're getting busier and busier by the minute. It's hard for people to build in, especially when they're traveling. And so I think, there really is a premium on keeping things simple. One thing that I often will do is actually use a higher potency agent, recognizing that patients may do well with, lower frequency of use that may be a little bit more feasible for them, but really just trying to, instill good practices at each encounter and really reinforcing those best practices. We always have those challenging patients, those really difficult ones where we do think they're adherent and they may be the exception and they don't do as well as we would hope, or it's just not possible for them. I have elderly patients that they're never going to clear their back because they just can't put it on their back, no matter how they try. And we've tried creative strategies. And so that is a scenario where sometimes they do need to be admitted to the hospital for a quick admission for wet wrap therapy, or where we start thinking about stepping up therapy to systemic agents because as much as they're coming with potential for adverse events, they are more feasible for the patient to be able to stick with on a daily basis. I think another scenario that comes up is for many patients where they truly are adherent and they do remarkably well, when they tend to have more persistent chronic disease, they, as long as they're on the steroids, they do well, but at some point when they stop because there's concern about adverse events, they may go right back to square one. And so that's where we certainly have to start thinking about the appropriate use of nonsteroidal agents or steroid-sparing agents as well. Steve, in terms of your cases that you see, and obviously you're working very carefully on adherence, do you still use hospitalization for wet wrap therapy a lot, or do you typically step up more towards the some of the either older fashioned systemic therapies or the newer ones that are available now?
I cannot remember the last time I admitted somebody to the hospital for atopic dermatitis, now that we have the array of systemic options that we have. That may be a good next topic for us to discuss.